The nurse and the UAP enter the client room and discover the client is unresponsive. The nurse and the UAP are both entering the patient's room, and they find the patient unresponsive. This is a keyword. Which action, according to the American Heart Association guidelines, should the nurse assign to the UAP first? So this is not only a American Heart Association style question or CPR, but it's also a delegation question. So you have to follow delegation guidelines to answer this question. What do you think is the answer? Answer number 1 says, ask the UAP to check on whether the patient is asleep. For the UAP to check on the patient, she's doing an assessment. And we know that based on delegation guidelines, UAP cannot do assessment. And also is unnecessary because on the stem of the question, we were informed that the patient is unresponsive, not sleeping. So number 1, we can eliminate. Number 2 says, tell the UAP to perform cardiac compression. Let's leave number 2 as it is. Number 3, instruct the UAP to get the crash cart. I like that answer also, so let's leave it. And number 4, request the UAP to put the client in recumbent position. Whenever you see a change in position in an NCLEX question, you need to identify why the change in position and if it helps with the current situation. See, this patient needs CPR, so recumbent position is not the correct position for this situation. So we can eliminate answer number 4. Now we have 2 and 3 to think about. What is the first action that we should assign to the UAP? Remember when we read the beginning of the question, he said that the nurse and the UAP were entering the patient's room. So we got both the nurse and the UAP inside the room. Who do you think is more qualified to perform CPR? The nurse or the UAP? And the other question is, who should leave the room to find the crash cart? Is the RN allowed to leave a patient by themselves when they are unstable? No. So the most appropriate action will be for the nurse to do the cardiac compressions. So we eliminate number 2. And the most appropriate response for the UAP is to get the crash cart, which is the correct answer.